Good afternoon, ladies and gentlemen. Thank you for joining our webinar today. I would like to introduce you to Dr. Todd Sasser, our field application scientist, and we'll be talking about our bone density software. Dr. Sasser?
Thank you, Meryl. Again, we'll be presenting the Bruker Bone Density Software module. This presentation is intended to serve as a somewhat quick start guide to the Bruker Bone Density Software module. We will also provide an overview of the X-ray imaging capabilities of the Bruker In-Vivo imaging systems as well. So as an outline and introduction, we will start out by briefly overviewing bone density applications and discussing some of the current methods that are used for making bone density measurements in mice and rats in preclinical studies. Following this, we will look at the capabilities of the Bruker In-Vivo systems, focusing on the planar radiographic imaging or X-ray imaging capabilities of these systems. Following this, we will overview the bone density software, a little bit about the models that are used in the bone density software and some of the requirements, the imaging requirements for the bone density software. And then finally, we will finish by providing some instructions on acquiring images for use with the bone density software, as well as processing and analysis with the bone density software module. So there are several applications, preclinical applications, where bone density software measurements are made. These include bone development, bone metastases, bone healing, arthritis, and osteoporosis. And there are specific animal models that have been developed in each of these disciplines for making analysis, preclinical analysis. Most of the studies are looking at one of two things, or sometimes simultaneously, molecular mechanisms and etiologies of diseases, as well as evaluating therapeutics. So the output data, when we're looking at a therapeutic, for example, might be, does the therapeutic change the bone density in the preclinical model? So probably the most common research where bone density measurements are made is in osteoporosis. The current rodent models, probably the most common rodent model that's utilized, is the overrectomized rat, which serves as a model for the postmenopausal osteoporosis. There are also pharmaceutical models, pharmaceutical-induced models. So induction can be through an agent such as estrogen receptor agonist. There are also models that utilize immobilization, so nerve resection, or some simple casting of the animal to immobilize joint movement, for example. And as a simple example on the right, a very nice example on the right from International Orthopedics, a group used overrectomized rats and evaluated the therapeutic response using bone marrow stem cells with and without a microsphere scaffold. And results were measured using DEXA, which is a technique for making bone density measurements. So if we look across our sample here at our different groups of overrectomized rat, our sham group, so a PBS group. On our y-axis here, we have our bone density measurement. Our cell group, so we see a higher bone density level. Our microsphere group, which is the scaffolding group that received a scaffolding microsphere, and then our group that received both the bone marrow stem cells as well as the scaffolding. The scaffolding was applied along with the bone marrow stem cells that would allow for retention of those stem cells at the site. So looking at a few of the common methods for making bone density measurements in preclinical models. DEXA, or dual energy X-ray absorption, as the name implies, the method applies two different energies when acquiring X-rays, and by subtracting out the lower energy X-ray, we can make an assessment of hard tissue density or skeletal structure density. The benefit of this technique is that it is relatively high throughput. A large number of samples can be scanned over a relatively short period of time. A criticism of this technique has been that it is only moderately accurate. For example, one common criticism is that it has been shown that you do get some increase in bone density readings simply with growth or aging of animal that isn't believed to actually correspond to true increase in bone density. Another drawback is that depending on how the DEXA scan is performed, you may only obtain a global bone density for the whole skeletal tissue. And in many cases, it would be beneficial to actually have localized bone density measurements. The second common technique is micro-CT. This is another X-ray imaging technique, and essentially this is a multi-projection imaging method. And after a multi-projection acquisition, X-ray acquisition is completed, the images are reconstructed to generate a tomographic CT, computed tomography image, and with appropriate calibration, bone density measurements can be made. One of the major benefits of micro-CT is that this method is very detail-rich. So you can make bone density measurements for different subsections of bone. So we could get a separate bone density measurement for cortical versus cancellous bone. And we also obtain in this kind of imaging, depending on the resolution, we might be able to make supplementary analysis of bone structure, not necessarily just bone density, but may be valuable to the experimental analysis. The drawbacks for micro-CT, relatively low throughput, frequently one animal at a minimum 1 to 2 minutes, typically for an acquisition, and depending 1 to 2 minutes or longer for reconstructions, and maybe even longer for performing analysis. Additional drawback is dose considerations. With a multi-projection acquisition where we're acquiring multiple X-rays at multiple projections, the dose can start to accumulate. This is particularly important where you're performing longitudinal acquisitions, where you perform a multi-projection acquisition over time. So that does have to be considered. A third technique would be ex vivo ash content. An advantage of this is that it's highly accurate. Disadvantage of this, it's very invasive. Typically, you need to use multiple cohorts for multiple time points. Animals frequently have to be sacrificed. It's relatively low throughput and highly labor intensive. The Bruker bone density software module provides some advantages over these existing methods for performing bone density analysis. Number one, it is a non-invasive and low-dose technique. So the animals can be imaged longitudinally at multiple time points and a single cohort. We don't have to use as many animals, for example, as you would if you were performing ex vivo analysis. Dose estimates much lower than you would achieve than you would incur with something like micro-CT. So something on the fraction of probably 1/20th the dose of some CT acquisitions for preclinical imaging. Very high throughput, so we can perform scans in 60 seconds. Depending on the number of scans that we want to make, we could actually decrease that exposure time probably down to around 5 seconds. And we can scan as many as five animals per acquisition. So the potential throughput here is dozens of animals imaging and analysis per day. And finally, the Bruker In-Vivo systems. Some of our systems provide multimodal imaging, so we have the potential to perform complementary molecular detections. So we have the X-ray imaging capability, and we have the possibility to look at things like inflammatory markers or bone turnover markers, for example, and these could target us to specific regions to look in more detail at the bone density of a particular region within a bone. The next few slides will look a little bit at the planar radiographic imaging capability of the Bruker In-Vivo systems. There are 5 in vivo systems, Bruker In-Vivo systems, that provide planar radiographic or X-ray imaging capability. These are the In-Vivo DXS PRO, which is a dedicated X-ray only imaging system. The In-Vivo FX Pro and In-Vivo Multispectral FX Pro, these are multimodal imaging systems that provide for optical, radioisotopic, and X-ray imaging capability. And then our most recent multimodal imaging systems, the In-Vivo Xtreme systems, the 16 megapixel and 4 megapixel system. With all the systems, acquisition and analysis is performed via the Bruker molecular imaging software. And then when the bone density software module, which is an optional item, is installed, it operates essentially as a plug-in within the Bruker molecular imaging software. The different systems are depicted here. To the left, the DXS Pro, FX Pro, and Multispectral FX Pro. The systems are modular, so the user can add modules that suit the application requirements for their research. All of the systems are equipped with animal heaters and porting for gas anesthesia. And to the right are In-Vivo Xtreme systems. The 4 megapixel system provides for maximum sensitivity. This little cartoon shows the operation for the X-ray component of the In-Vivo systems. So a phosphorus screen slides between the sample and the detector. These are inverted systems, so that the CCD detector resides below the sample. X-ray is applied overhead. Gamma energy strikes the phosphorus screen. The phosphorus is excited, relaxes, and emits photons. And so we're actually detecting photons on the CCD detector. The systems are configured with a 5-position aluminum filter wheel. So this allows us to harden the X-ray. You can see that to the left where we've used a no aluminum filter, or to the far right where we've used a thick aluminum filter, you can see the difference in the tissue contrast. So typically when we're interested in imaging hard tissue, skeletal structure, we'll use a thicker aluminum filter. And for bone density, we typically recommend that we use the 0.8 millimeter aluminum filter. The aluminum filter wheel is placed directly at the outlet of the X-ray source, so it filters out a potentially soft X-ray energy prior to applying this to the sample. It's also possible to change the voltage setting. So with higher voltage, we get better penetration of our sample. So you can see here, typically we would recommend using the highest voltage setting possible. You can see here with the higher voltage on the right versus the lower voltage 35 on the left, we get better penetration and better contrast across the body of this sample. The only time that we might recommend using a lower voltage setting is if you were looking at finer bone structure. So if you were looking at the digits, for example, you might want to reduce the X-ray penetration. So if you're looking at digits, you might reduce the voltage setting when you're imaging. Systems are also configured with a magnification stage. By positioning the sample close to the X-ray source, we magnify our image 3.35x. And so it is possible to position a full mouse within the magnification stage. Typically for the standard imaging, there is a tray positioned below this magnification stage, but for the highest resolution, achievable resolution, we'll position our sample here in the magnification stage. You can see an example to the right of a mouse head imaged in the magnification stage. The Bruker In-Vivo systems have been employed for several different bone imaging applications. In this case, we're looking at a bone metastatic model in a nude mouse. Mice were injected intracardiac with the cell line MDA-MB231, which is a breast cancer cell line which is known to metastasize to the bone. And you can see here at 10 weeks our normal bone structure, and then here we can see degraded bone structure where we have metastatic degradation in this femur. Another example of bone development, looking at on the left a control animal and then on the right a knockout animal, where we see disruption of the growth plate formation on this sample. A bone healing model, frequently drilling into the bone and then potentially looking at different therapeutics. Bone healing can be observed. So the top 1 millimeter hole you can see has started to heal, and the lower hole is a newer hole which has not started to heal yet at the point of imaging. So we had mentioned the multimodal imaging capability of the systems and the potential to complement our X-ray imaging with fluorescence imaging or nuclear, radioisotopic, or luminescence imaging. So in this example, we'll show with this cartoon the fluorescent imaging configuration for those systems that have the molecular imaging capabilities. So illumination is from below. The phosphor screen is off to the right. We have an open window below our sample animal. We illuminate with a 29-position filter wheel, and then we have inverted detection from below for fluorescence. So we're able to detect targeted fluorescent probes, reporter enzymes, and fluorescent macromolecules. This is a published example from Arthritis Research and Therapy from 2011, looking at the potential, or showing the potential for multimodal bone imaging application. And in this example, the group is working with a arthritis model that has been created or induced using bovine collagen, so essentially a rheumatoid arthritis mouse model, preclinical model, and then they have treated the mice either with PBS or different combinations of therapeutics. So etanercept is a established anti-TNF-alpha treatment therapeutic for rheumatoid arthritis, and our RB200 is a candidate therapeutic, and they have either administered the agents individually or in combination, and then they have used a anti-E-selectin fluorescent antibody, near-infrared antibody, as a marker for inflammation and arthritis in the feet pads of these animals. So you can see here with PBS we have robust inflammation. With RB200 alone, we still have inflammation, but it's significantly reduced. With etanercept, again, also reduced inflammation and reduced looking at the bones and reduced size of the feet bones, reduce indicators of arthritis, and then the combination therapy RB200 and etanercept, we have significantly reduced overall inflammation with the fluorescent reporter, as well as decreased paw size. The next several slides we'll introduce the bone density software module. The method that is employed in the Bruker bone density software module was originally reported in computer methods and programs. Essentially what the software allows you to do is to make bone density measurements from planar X-ray or planar radiographic images in the long bone regions of the sample. And so we can see a display here, a long bone, and then a region of interest with regions X1, X2, and X3. So X1 represents inner bone, X2 outer bone, and then X3 is our median. So each one of these regions needs to be included because they are part of the bone cylinder model that is employed in the Bruker bone density software module. And then we can see here some of the metric output and a visual display for the bone density software module. So some of the metric values that we obtain are the radius for inner and radius for outer bone. We also get X-ray attenuation for our bone column as well as for the medium that the bone is contained in. So this is assuming tissue, and this says, and so it is important that the bone measurement is made within tissue, so within an animal bone that has not been cleaned of tissue. This is a display of the software analysis within the Bruker MI software and using the bone density software. So you can see how we've created perpendicular regions of interest across the long bone, and then we would select the bone density button, and then we would obtain several bone density values. Most importantly is the bone density, grams per cubic centimeter of calcium phosphate. So this is going to be the value that most end users would be interested in recording. So again, some of the values that are obtained. So this is the output that we get from the bone density software. We get a thumbnail for the particular ROI that's being displayed. And again, most end users would be interested in this bone density measurement. But we also get X-ray attenuation output value. So this is essentially an equivalent to an optical density except for X-ray within the bone. And so these could potentially be valuable metrics for making comparisons in bone density studies. But for the most part, the bone density measurement is what we're looking for. Another value that we want to look at here is the chi-square value. The chi-square value is an indicator of how well our ROI fits the cylindrical model. So typically values from between 5 to 80 are acceptable. If they get much higher, it might mean that you need to change the positioning of your ROI or draw your ROI within a region of bone that represents a cylinder. And as an early preliminary study using the bone density software, some comparisons for mouse pups as they aged was performed. So we can see here at left a single time point, day 3, where full bone formation has not completed, and then at day 16 where bone formation is more complete. And looking at the femur density and metatarsal density of bone development over longitudinal time points here, ranging up to 60 days. And so, of course, we also wanted to make a comparison to an established technique. So we looked at knowing that mice of different age over early life have different bone density, looked at mice at age 33 days versus 80 days, and compared this to micro-CT bone density measurements. So in the left, we made bone density measurements using the Bruker Albira CT imaging system. The system was calibrated using a hydroxyapatite phantom. And we can see in blue the in vivo measurements. So these were in live animals, the 33-day and the 80-day in green. And then ex vivo measurements, micro-CT, and then the measurements made using the bone density software module and planar X-ray imaging using the Bruker In-Vivo system. These values correspond very nicely. So the Younger mice have a lower bone density value, and the older mice have a higher bone density value. Finally, we'll review the bone density software module operation. So looking simply at in sequence calibration, as well as some recommendations for our acquisitions and our analysis. So calibration will typically be done if you've ordered the bone density software module originally. When you've purchased the imaging system, will be done by a Bruker representative. The calibration is a very straightforward, automated process that only takes a few minutes and can be easily run by the end user, and can be installed when if the bone mineral density software module is added at a later time point. Acquisitions will look at optimum settings and also point out the process for creating illumination references, which should be applied when bone density analysis is being performed. And then finally, the workflow for performing analysis and proper ROI positioning. So we referenced earlier the original report on the bone density software module algorithms. This was reported in Computer Methods and Programs. Part of the algorithm, a component of the algorithm includes a density coefficient that was empirically obtained by imaging different hydroxyapatite concentrations in different depths of water. And in order to ensure that these coefficients apply to imaging on Bruker In-Vivo imaging systems, the calibration needs to be run so that the coefficients used are compatible with the X-ray density values that are obtained with the Bruker In-Vivo systems. And these are showing some of the density coefficients with hydroxyapatite and calcium phosphate imaging in different depths of water from the original report on the software. In order to run the calibrations, it's a simple process. We go to the capture menu, we select preferences. So from here, we go to calibrate, and then we simply select X-ray. And then the system will prompt the end user on the expected finish time, and we can remove everything from the imaging system, and it just runs through essentially all the different possible combinations of filters and energy in order to calibrate the system so that it will be compatible with the bone density software. If you want to check to see that your system has been X-ray calibrated, the software will tell you if you try to analyze an image and it hasn't been calibrated. But you can also, after acquiring an X-ray image, if you look down in the bottom right-hand corner in the display, if the system has been calibrated for X-ray density, we will have a X-ray density unit in the bottom right-hand display. This is a table with some general recommendations for settings for imaging for subsequent bone density analysis. So previous in vivo systems, DXS, FX, and multispectral FX Pro systems were lower energy X-ray imaging systems. So they provided 125 microamp and the maximum of 35 kVp. So you'll be working with, if you have a older generation Bruker In-Vivo system, you might be working with a slightly longer exposure time. You can make some adjustments if you do need to obtain exposures with shorter time. You could, for example, decrease your f-stop value to something like a 2, and then you could decrease your exposure time. But these are going to provide high quality, nice contrast with a large number of pixels. So the important parameters here on all of these is that we typically do not want to perform any binning for our bone density images. You can perform binning, but if with no binning, we'll have the maximum number of pixels for performing our bone density analysis across our bone structure. Newer generation systems are higher energy, so we can acquire images faster, so 60 seconds, for example, on the latest generation systems, and they have higher voltage settings as well. In all cases, we're recommending that you use the thicker aluminum filter, but again, these are just guidelines, so you can make adjustments to your settings and still perform bone density analysis, but these are the settings for nice, high-quality bone X-ray imaging. And then the recommended settings on the In-Vivo Xtreme: 4 megapixels, 30 seconds, an f-stop of 4. And decreasing the f-stop here or adding binning, you could, if you needed to, if you had dose considerations, get this exposure time down to below 5 seconds, for example. And then the In-Vivo Xtreme 16 megapixel recommended settings as well. So this shows the capture menu for the In-Vivo FX, and we show here no binning, so we're using the maximum number of pixels. We want to make sure that we apply a reference file so that we get a nice, consistent, even X-ray image. We're selecting the 0.8 millimeter aluminum filter. And then just to point out, if you are imaging your sample within the magnification stage, so if you've put your sample, your animal, within the magnification stage, you do need to check the magnification checkbox. This will ensure that the correct geometric interpretation is applied. And vice versa. If you have the sample in the lower stage, make sure that that mag stage checkbox is not checked. Just to point out, appearance of image without an illumination reference to the left and with an illumination reference to the right. And on our In-Vivo Xtreme systems, the illumination references will be factory generated, and so all you would need to do is simply select apply reference. On our In-Vivo FX, multispectral FX and DXS PRO systems, you may need to actually generate your illumination reference for the particular settings that you're using. So won't go into detail into that process. It's a pretty straightforward process. Essentially, you will set your parameters for your X-ray setting, and then prior to executing your X-ray setting, once you have all of the pull-down menus and all the parameters set, you'll acquire an illumination reference acquisition. In order to do that, change from standard exposure to illumination reference. Use whatever defaults the system changes, select expose. Return to the original capture setting that you have programmed, and then go to apply reference file, and it will pull in the illumination reference that you've just created. So illumination reference is just an acquisition with no sample present, and it's correcting for the cone of illumination from the X-ray source that you get, so you get that nice, even image. This shows the acquisition screen for the In-Vivo Xtreme systems, and the same critical parameters for bone density auto. Typically, we recommend using a 0.8 millimeter filter and then no binning, so we get maximum number of pixels. So once you've acquired your image, we'll show here the process. We go to manual ROI, zoom in. You'll have a little bit more control for your regions of interest. Look at a target region. We'll create a rectangular ROI. Activate it by clicking. We select the ROI rotation tool and want to adjust that rectangle so it's perpendicular to a cylindrical region of the bone. Noticing we have overhangs. Finally, we select bone density, and our output is located here. A couple of points just to reiterate. When we are drawing ROIs, the two left ROI examples are incorrect. We do not want to draw regions of interest around joint. We need to draw within a region of bone, of long bone, that is a cylinder. We also need to draw overhangs. So in this example, the region of interest does not include that tissue medium that is required for the bone density model. And on the right, we show the correct, an example for correct ROI. So we've created the region of interest perpendicular within a true bone cylinder, and it has overhangs slightly into the tissue. A few final miscellaneous points regarding the bone density and use of the bone density software. The calibration necessary for the bone density software is only possible with the automated Bruker In-Vivo system. So these are all of the current X-ray Bruker In-Vivo systems available. There were some previous models that had some manual operation. So if you want to perform bone density analysis, you would need to upgrade your system to an automated motorized Bruker X-ray imaging system. The model is designed for small animals, so this is rodents. It has not been validated for larger small animal models. And the model assumes bone and tissues, so ex vivo measurements are not necessarily recommended. And then finally, we've already mentioned it, but just to reiterate, the measurements should be made in cylindrical regions of long bones. Okay, well, thank you for attending today. If there are any questions, I would be happy to take those at this time.